This is absolutely an urgent public health issue in Tennessee, and when we think about these babies that are born with neonatal abstinence syndrome, it really is symptomatic of the broader issue of prescription drug, and particularly opiate pain reliever misuse and overprescribing.
Prescription opioid use is affecting a broad scope of our population, and I think we're beginning to see that effect in pregnant women and kids. I often describe an infant going through withdrawal as a colicky baby times 5. When infants going through withdrawal commonly are inconsolable, they have difficulty feeding, they're more likely to have respiratory complications, and less commonly, but does occur, they can also have seizures. And we know that infants that have neonatal abstinence syndrome or are born exposed to opioids are more likely to be born low birth weight as well.
So opiate addiction in expectant mothers is particularly challenging because it is a situation that has started well before pregnancy and often years before pregnancy. What we find with a lot of these women is that they use the drug to function, to do normal daily activities, not necessarily to get high.
With opiates, you get very sick if you don't have them. And when you're a mom, you can't do that. You can't, it's like having the flu, like being very, very sick if you go a couple days without anything. And so you can't care for your children, you can't change diapers, you can't go get a juice, you can't do anything. When it comes to treatment, that's just kind of that thin line right there. If you can't get in and get help, immediately, then there's nothing you can do. You have to go and you have to get more. And so after a while, it's almost like the choice is gone.
One of the issues with this legislation is it seems to not really address the medical nature of addiction, and in particular opiate addiction. And the problem with pregnancy, which a lot of people don't understand, is that these drugs cannot just be stopped in pregnancy. The physical problems, withdrawal symptoms take a great physical toll, and that also takes a toll on the fetus and can really endanger the pregnancy if these drugs are abruptly stopped. These women come to the physician's office with a lot of fears. They fear repercussions, not only from DCS or authorities, but they also fear judgment.
Every mom wants to just be a good mother and take care of their children and just be able to do that. And it's really hard to not feel guilty or ashamed when you know that you have been doing things that aren't in their best interests. I've seen it firsthand with other women who get pregnant, try to get help, cannot get help, so they have a baby, and of course the baby's born addicted, and now they're going to be sent to jail. That makes no sense. It's really not right, and we wouldn't treat other sick people that way. I mean, we're saying that they're sick and that they have a disease, and so lock them up is just ridiculous.
Bottom line, Tennessee is going to get a hold of this. Tennessee has been very forward-thinking and thinking about broad public health interventions to limit prescription abuse and misuse, including the prescription drug monitoring program, which has been very effective in limiting misuse of prescription opioids. I think we'll begin to see the effects of this first through overdose death reduction in adults and then through infants having drug withdrawal. I'm hopeful that with broad public health approaches like this, we'll begin to see fewer infants having drug withdrawal in years to come.
Right now, it appears the epidemic is getting worse in terms of NAS. It will be a good thing when we start to see those numbers plateau and then ultimately decline, but at least for now, we're continuing to see them rise and rise even more than they did last year. I think that there are some positive aspects to this, though. We know that we've seen a 50% reduction in doctor shopping through use of the Controlled Substance Monitoring database. We hope that that will then translate into fewer overdose deaths, fewer NAS births, but those will probably be lagging indicators. But we hope that this is some initial promising news that foretells a decrease in NAS as we move ahead.